Female genital tract tuberculosis seen in a 22-year-old married for just 2 months and presented with progressive abdominal swelling, pain, loss of appetite, weight loss, and low-grade fever. What gave me a clue to the diagnosis of this case, besides the history, is the doughy feel on abdominal examination. There was no discrete mass. Ultrasound findings, presence of ascites, thickened peritoneum, fallopian tubes, and bowel loop were noted. So my impression was suspected female genital tract tuberculosis. Remember, the diagnosis of tuberculosis needs a high index of suspicion, especially if one is dealing with a female genital tract tuberculosis. So this was the initial video at the time of the initial ultrasound. So here is the bladder, the uterus. You can see the ascites here, and not the appearance of this bowel here. Not the peritoneum here is thickened. Here is the fallopian tube on the right side. Also not that it's thickened. This is the ovary with multiple follicles. Again, this is the bowel here, omentum there, the ascites. The uterus in transverse section, the adnexa, and not this echogenic foci, some casting acoustic shadows. That's the other ovary here. Again, not this echogenic focus within the right ovary. The tube there. Not the peritoneal thickening. This one looks like hyperperistalsis here in some parts of the bowel, the liver, ascites. So let's move to the next video. Which was 1 week later. This is a transvaginal image. Look at the thickened right fallopian tube. Again, look at here, the thickened left fallopian tube. And this are the ovaries. So not this echogenic foci within the ovaries. And look at the surface of this tube is not smooth. Look at these projections on the surface, the fallopian tube, and not this echogenic specks within the ascitic fluid. And again, look at this tube also with some appearance. And look at these echogenic areas within both ovaries. That's a round ligament is normal in appearance. Note that the surface of the fallopian tube here is not smooth, as you can see. Same with this. The ovary here. Look at this area is more echogenic. You can see that the debris on the surface appears to move on probe pressure, and as it moves, it appears it disperses the echogenic materials into the acetic fluid. So you see that, look at the peritoneal thickening here. Look at the peritoneal thickening, what is called the pelvic blanket sign of female genital tract tuberculosis. Again, note that the surface of the uterus is not also smooth. You can see this flex of tissue on the especially posterior surface of the uterus. You see that? So let's move to the next slide. Here you can see a thickened fallopian tube. Here I decided to use a Doppler to pick a protodiastolic notch, which is seen here. And look at the measurements of the fallopian tube here, 1.3 centimeters. And look at the normal measurement of the fallopian tube. So this fallopian tube you can see is thickened. Here again, look at the thickened peritoneum here. Look at the fimbriae here. The thick fallopian tube, 1.37 centimeters, and not the normal thickness of the fallopian tube. So 2 weeks after the first scan, the result of ESR was out, 110 millimeters mercury, mannitol was positive. Chest X-ray was, however, normal. So you can see this hemorrhagic cyst 2 weeks after the first scan. This is hemorrhagic cyst. So after 2 months of antituberculous treatment, note the appearance of the ball here has changed. The echogenic foci still remain, but look at the thickness of the tube here has reduced to 0.8 from 1.37 centimeters. Both ascites still present. Appearance of the bowel has also changed. After completion of 6 months of anti-TB, ESR came down to 26 millimeters per hour from 110 millimeter per hour. So here you can see the bladder, the uterus, part of the ovary is seen here. And note that the ascites is now minimal. It's minimal here. And note the bowel compared to the initial scan before commencement of treatment. Here the fallopian tube is not seen here because there is no significant fluid in the peritoneal cavity to allow demonstration of the fallopian tube. You can see the ovary here, and note that the echogenic area seen in the first image is no longer seen here. So these are the still images 6 months after, slight fluid collection. normal ovaries, normal uterus. So now let's compare the ultrasound image before commencement of antituberculosis and after completion of antituberculosis. So this is after completion of antituberculosis treatment. You can see the bladder here, the uterus, note the appearance of the bowel and compare it with what we've seen before commencement of treatment. Look at the bowel here, the appearance, and compare it the appearance of the bowel before commencement of treatment. So now let's play the first video. So you see that, look at the bowel, the appearance of the bowel here, and compare it with what we see after commencement or after completion of the 6-month course of antituberculosis treatment. So you can see the ascites here, the thickened fallopian tube, the echogenic foci got on the surface of the fallopian tube, the ovary and posterior wall of the uterus. So the omentum here, the bowel here, and compare with the bowel here. This is the beauty of follow-up. Patient is better, patient has improved, and she has been discharged from the clinic. So thank you very much for listening.